Hello everyone, welcome to Apollo 24/7's YouTube channel. Today we are in Apollo Hospital's Jubilee Hills, Hyderabad, in conversation with Dr. Tripti Deb, who will help us understand heart health.
Yes, nowadays we are seeing that every day we get a news that a young person at the age of 20, 30 or 40, below 40 is dying suddenly, either in their sleep or they are dying in the gym workout or they are dying in their offices suddenly. Any time of the day or night, there is a sudden death. That means suddenly the person collapses without any prior intimation, or sometimes there is some not a prior intimation exactly, but there are some not very critically ill patient, means they have some mild kind of chest discomfort, like some gases, some kind of uneasiness, some kind of sweating, some kind of, they try to take some Eno or they try to take some Gelusil, etc. to think that this is a kind of a gas. The gas could be a block in the coronary artery, or any kind of non-specific symptom, we call it, just like a vague chest pain, a vague uneasiness, a kind of little breathlessness. Suppose yesterday he did a gym for about 2 hours and today within 1 hour the person gets a breathlessness, some uneasiness. So that could be the first premonitory warning symptom for a kind of a heart attack which is coming up. So this is a pre-heart attack symptom. Why it happens to the young person? It is very important to understand. In our community, we have familial dyslipidemia. That means the cholesterol. Which is the bad cholesterol? That is LDL cholesterol. That is low density lipoprotein. Normally, if we keep the low density lipoprotein levels below 70 milligram per deciliter, that is protective and that doesn't get deposited into the coronary vessels. So what is it? I would like to explain. That is atherosclerosis. So how it happens? So there is a picture here, and this picture shows you that how we are born. When we are born, there is no blockages at all. It's absolutely clean artery. The inside of the vessel is absolutely clean. There is no plaque here. By the age of 3 to 7 years, this kind of yellow streaks they develop. That is in the big vessels of the heart, that is known as aorta, or the branching vessels. Second, then third stage comes here, when the plaque, that yellow streak, becomes a much larger block. See, it is layering into a much larger area, and the area of the artery, the circulation is getting choked. Slowly it develops in more and more, which is known as atherosclerosis. And in this stage, the artery is getting blocked by 50%. Here also person may not know. By this time when the artery becomes 70% blocked, the coronaries, the blood circulation of heart muscle, then at this stage, 70% block, when they do vigorous exercise or some kind of activities, some playing games, they'll feel some tightness, some kind of heaviness, some kind of uneasiness, and they might have to stop much earlier rather than finishing the exercise. That is a warning symptom. So 70% means there is a warning of a heart attack coming up. That is known as angina. That is a kind of a heart block which is giving a symptom. Then comes the plaque rupture. After heavy exercise, after heavy meals, after heavy unusual kind of stress, after not sleeping a long time, like not sleeping properly, any kind of stress which is going on in the body, the plaque ruptures. The plaque ruptures and it causes a breakthrough into the atherosclerotic vessel, and that causes a blood clot formation, and this blood clot causes heart attack, and this can happen any time of the day or night, and this blood clot blocks the blood circulation to the heart muscle. Heart muscle doesn't get oxygen, and once there is oxygen deprivation, that is known as severe ischemia, that causes the irregular heartbeat. We call it ventricular fibrillation, and that causes cardiac arrest. There is no effective contraction of the heart muscle at that point of time, and suddenly the patient collapses, either in sleep or during exercise, or maybe waiting after exercise, or maybe after heavy meals or something like that. And then once the patient collapses, there is no heartbeat, nothing. The carotid vessels will not show any pulse. The radial will not show any pulse. If somebody knows how to revive this heart, that is known as cardiac arrest revival, that is CPR. Cardiac arrest should be revived immediately, cardiopulmonary resuscitation. How it is done? There are classes we conduct regularly to make the person aware of doing the CPR. So all the health professionals, all the gym professionals, all the technical staff and all the gym guidance, those who are doing coaching, they should know how to do CPR. In such crucial places where it is possible to happen, there they should know how to do CPR. CPR should be done within 5 minutes. If you don't do CPR within 5 minutes, then the heart stops for a longer time, more than 20 minutes. If you revive the heart, then the muscle of the blood circulation of the brain completely stops and the patient becomes brain dead. And once the patient becomes brain dead, it is too crucial not to stay too long away from the brain blood circulation. If brain blood circulation is not re-established within 3 to 5 minutes of cardiac arrest, there is a permanent brain damage. They are known as brain dead patients. By the time patient comes to us in the ambulance, it is too late. It happens 10 minutes, 40 minutes, 30 minutes after the cardiac arrest. And when we revive such patients by CPR and by advanced cardiac resuscitation, the patient's brain is already gone. It doesn't come back. So this is a very sinister situation. That's why every person in every family, somebody has to understand and know the CPR immediately before the cardiac ambulance comes and does the cardiac resuscitation properly with a cardiopulmonary shock therapy. We call it external cardiac defibrillator to get the heart back to the normal rhythm from the ventricular fibrillation and ectopics. Now, second question comes, why this happens? Why it happens to young people? In our population, generally, we have 1 in 200 person having dyslipidemia, that is where the cholesterol is high. That means LDL is more than 150 and total cholesterol is more than 200. In such situations where there is family history of heart attack, anybody having their family member like parents, grandparents, uncles having the heart attack before the age of 40 years should have their first cholesterol level, that is lipid profile, done before the age of 10 years or at least by 10 to 15 years of age. If not done at least by 20 years, there should be lipid profile done and should be checked whether their lipid is within range or not. If not, then they should be treated at that time by lifestyle modification, like many ways of treatment, including the treatment protocol with the medicines if necessary much earlier. Then every person, those who have a family history, should have a healthy heart checkup done by the age of 20 years. In that we have echo treadmill. Treadmill test is a very good test where we put the ECG leads and the patient does the exercise and we can see the changes in the EKG. If the changes can be monitored properly and we can detect the changes in the EKG during exercise, we can understand that patient is at this level, and there we can catch this patient before it goes to this level of heart attack and we can rectify that. So this is how we can prevent an early heart attack in a young person.
For any heart-related concerns that you have, you can consult an Apollo expert by downloading Apollo 24/7 app now.